Welcome. I'm Dr. Paul Woolley, Chief Science Officer for Kardiatonos. Historically, high levels of LDL cholesterol were believed to be one of the leading causes of cardiovascular disease, or CVD. However, recent developments have shown that high cholesterol may only be a sign of CVD. The cause could actually be damage to a little-known microscopic gel-like lining in the arterial walls called the endothelial glycocalyx. The endothelial glycocalyx is the blood vessel's first line of defense against the intrusion of foreign matter, and it acts as a protective barrier for the entire vascular system. Made of a specialized matrix of polysaccharides and proteins that's only about 5 microns thick, the endothelial glycocalyx assists the body in balancing blood flow and maintaining osmotic pressures. When it's healthy, the endothelial glycocalyx maintains proper blood flow and allows fats and cholesterol to glide freely through arteries and veins. Cholesterol, in and of itself, is not the enemy. The real threat is when it's allowed to stick and penetrate the arterial walls. This is the artery, and here is the endothelial glycocalyx. Under the endothelial glycocalyx are endothelial cells, line the arteries, veins, and capillaries throughout the body. When the endothelial glycocalyx is damaged and breaks down, the interior of the artery loses its lubricated texture, and gaps are created. These gaps become adhesive for matter such as cholesterol and fats. The endothelial glycocalyx is most likely at its healthiest levels in young children, but the vascular system constantly sheds components of the endothelial glycocalyx and regenerates them over time. However, environmental conditions affecting the quality of the circulating blood, natural vortices of blood flow, and aging create stresses that may slow the time it takes for the body to replenish this vascular lining. At Kardiatonos, our focus on health, science, and innovation has brought us to a new understanding of the endothelial glycocalyx and its essential role in cardiovascular health. We are developing solutions to allow physicians to combat chronic cardiovascular disease. There are currently only a small number of tests that infer the possible status and progression of CVD. That is why we are developing Kardiacalyx. Kardiacalyx is a first-of-its-kind cardiovascular diagnostic test designed to give physicians true insight into the status of a patient's vascular health. Our specialized 4-panel biomarker test utilizes simple blood samples. The test determines the amount of endothelial glycocalyx disruption, shedding, inflammation, and oxidation affecting the arterial walls. This allows physicians the ability to both determine the onset and progression of cardiovascular disease. Kardiatonos has also developed a solution for the treatment of endothelial glycocalyx disruption with our leading therapeutic candidate, Thrombex. Thrombex is a cardiovascular therapy that, in initial testing, has shown great promise in treating the root causes of chronic vascular disease. Our anti-thromboembolic pill both treats and helps prevent CVD by targeting the multiple pathological pathways whose actions contribute to this chronic disease. Preclinical evaluations have shown that Thrombex effectively repairs and restores the integrity of the endothelial glycocalyx by stimulating antioxidative enzymes which act to stabilize the lining and reduce inflammation. Visit our website for further information on the endothelial glycocalyx and our novel approach to the diagnosis and treatment of cardiovascular disease.